Good evening, everyone. So today, as you all know, that we are celebrating the IOA Bone and Joint Week, which has been started from 3rd of August, and we will be culminating it tomorrow on 10th of August. And throughout this week, we have done lots of activities, and today is the second last day of Bone and Joint Week. So today, we have gathered here for a proper webinar on osteoporosis and fall prevention. And we are doing this event along with the IMA Karol Bagh Branch, whose president and secretary are with us. We are having an honor to have them. So Dr. Ashok Damir, he is the president of IMA Karol Bagh Branch. And I would like to ask sir for his few words and his suggestions for the elderly people based on his experience that what should be his advice to them.
Yeah. Good evening, everybody. Dr. Ravi Chauhan, who is known for his social work also, other than doing great orthopedic work. Dear friends, as you know, as the age advances, and particularly in post-menopausal women, the bone health is very important, and it is most of the time jeopardized. So we need to educate the masses for the consumption of more, I would say, the calcium product like milk and milk products or calcium in any form. And osteoporosis is not uncommon at this age, particularly in postmenopausal women, as I told, and elderly, of course. So I would like to congratulate Dr. Ravi for starting this type of campaign in which he, for 1 week, he and his colleagues have been doing a lot of activities to promote the bone health. So I wish him all the best and good luck, Dr. Ravi Chauhan. Very good. You are doing a good thing. Yeah.
Thank you, sir. Thank you, sir. To move on further, I would like to invite my friend and Dr. Karun Jain just to introduce our both the speakers that we are having today. The Secretary of DOA, Dr. Sandeep, and Dr. Samir Mehta, who is currently the President of North Delhi Orthopaedic Association Society. So, Dr. Karun Jain, please.
Good evening, everyone, and thank you, IMA Karol Bagh Branch, for joining this movement or tsunami, what we call, for the care for the elderly. Good evening, Dr. Ashok and Dr.
Oh, good
Chakraborty.
evening, sir.
So, coming to
Okay.
this CME per se, so it is my honor and privilege to introduce the most two stalwart of Delhi Orthopaedic Association, and both of them require no introduction. Uh, Based on this theme of Indian Orthopaedic Association of elderly care, we have a dedicated CME and our two speakers. First is Dr. Samir Mehta, sir, who is senior orthopedic surgeon and president of North Delhi Orthopaedic Association, and a very social person and very soft spoken orthopedic surgeon, I would say. And second is our again star Dr. Sandeep Kumar, sir. Dr. Sandeep is currently serving as a secretary of Delhi Orthopaedic Association and joint secretary of Indian Orthopaedic Association. And Dr. Sandeep is famous not only in Delhi, he is famous across India. So I request I think Dr. Samir Mehta sir will start the first talk. So without wasting any time, I would hand over the mic to Dr. Samir Mehta sir to start his proceedings. Thank you.
Am I audible, Dr. Karun?
Yes.
Yes, sir, you are audible. Please go ahead, sir.
Thank you, Dr. Karun, for such a flowery language that you used to introduce us. But this is the very kind of you. Thank you, Dr. Ravi, for the efforts behind this big seminar and inviting all the dignitaries from the Karol Bagh branch of the IMA. And I greet them from my heart. Thanks again to all my DOA EC colleagues, especially Dr. Sandeep Kumar, who is the secretary and a very good friend of mine. Dr. Ravi needs no introduction. Karun needs no introduction. They are the young, young stars and shining stars of our DOA, and we can't see any event being happening without the presence of our young brothers here. And I also greet Dr. Atul Vash, our past president, Dr. Kamal Khurana, who's a very active member of North Delhi Orthopaedic Society, and of course, Dr. Meena and others. Thank you very much for the invite. So I begin my talk on osteoporosis, and I'll just start sharing it. Okay, so are we So can everybody see my presentation, please? Everybody?
Yeah, it's visible, sir.
Carry
Good.
on.
Okay, so it's a great endeavor by Indian Orthopaedic Association celebrating Bone and Joint Week, and the presidential theme, of course, is Old is Gold, where we are really want to take care of the elderly, 360-degree care, and the first and the foremost is their mobility and their longevity. And here comes the knowledge on osteoporosis and why it is so important to deal with it. Okay, so osteoporosis is a silent killer. It is known as a silent thief. Why a thief? Because slowly over a period of years, over a period of decades, as the person progresses in life and starts aging, the bone starts leaching away, the calcium, the minerals start leaching away, and the bone mass decreases. So that's why osteoporosis is called a killer or a silent thief. And the person doesn't even know till he goes from early stage to an advanced stage, and then it's difficult to handle even by expert physicians like us. So, and it most commonly starts with back because it's got a cancellous bone. We all know that. The vertebral bodies, and of course, the hips and the necks. We, being orthopedic surgeons, we commonly see in our clinics more often and emergencies more often with a trivial trauma when an aged and an elderly person is walking to the toilet or is just walking, he trips on the carpet and just a small jerk and he's unable to walk, he's bedridden, and the whole family is aghast that nothing happened, sir. But we know that he was an osteoporotic patient, untreated osteoporotic patient, and that small jerk crackled the bone like a simple papad that we have in food, and it just breaks. So this is what osteoporosis is, it, and the severity is. And so it's hip bone, wrist bones, any bone rather, but these are the common bones, that pelvic bone, which commonly get fractured by very, very trivial trauma. And this could be osteoporosis. And these figures 1, 2, 3, 4 from left to right show how the bones really start weakening and it's jaise khokhla ho jata hai andar se, it goes like that. And from healthy bone to penia to porosis, then severe osteoporosis. So this is a very nice depiction, a 3D depiction of osteoporosis on the hip area. Stages, as I just seen, from normal to severe. Who will suffer from osteoporosis? Well, this is a little glamorized, I would say, slide. Female people are more, especially since females, in post menopausal time, smokers, alcoholic, and these are known osteoporosis generators, elder members. Then there are sedentary lifestyle who haven't got a chance to build up their bones, obesity. So all these pre-morbid conditions, thyroid patients, we all know very well, rheumatoid arthritis patients, asthma patients, because they use steroids and all sort of drugs, which ultimately weaken the bones, and then diabetes. So these are the patients who are more prone. And to deal with osteoporosis, we have to deal with all these pathologies, and we have to recognize these pathologies well in time to actually not let them go become osteoporotic patients. Cancer patient, of course, all those chemotherapies and radiotherapies are big culprits. Anti-epileptic drugs, because they work on the liver. Liver is the one which manufactures one half of the vitamin D, which in fact absorbs the calcium from the gut and all other receptors in the body. So all patients who are on ATT, commonly tuberculosis, such common in India, and ATT is damaging the liver. It's liver toxic. And this causes all the osteoporotic features to manifest later on. Steroids, everybody knows, even a layman knows how harmful the steroid, unless taken under care and a good monitoring of orthopedic surgeon. So insufficient and malabsorption syndrome, nothing is getting absorbed. So no calcium, no minerals are getting absorbed. How do the patient or the particular person subject really builds up his bone or nutrition? So insufficient digestion, chronic pancreatitis, carcinoma, diverticula, there are IBS of the gut, And gut pathology and gut health is such an important thing here, to build nutrition. And nutrition, of course, is part of controlling osteoporosis. So this this slide is so important. Consult the doctor. Now there's a trend in India, uh, you find, I see everybody around me, my fellow citizens in our country, they find shortcuts. They'll go to quacks, they'll go to palwans, they'll go to chemists, pharmacists, they will even go to WhatsApp University or even Pados ki Amma for that matter to ask about ki mujhe ye takleef ho rahi hai, but they will never go to a doctor. And when they really go, it's already a bit late. And then we have to handle all this. So do that. Friends, consult any doctor nearby, as quickly as possible once you start suffering from any kind of pain in your body. The foremost investigation, or rather a gold standard, is DEXA scan. DEXA scan is a scan to detect osteoporosis. It is done in various bones, but commonly in spinal area and the hip region, which are most commonly affected. So DEXA scan is commonly being done in a city like Delhi. It might be a little bit difficult in peripheral cities or in what we call B or C cities. But in Delhi or metropolis, it is commonly available in most of the centers which do MRI and CT scans. They also have DEXA. So this is the first thing that a doctor or orthopedic surgeon subscribe to for a patient. So get that done. And besides then, there are symptoms of pain in the back. There are symptoms of sudden pain, like I told you, which and patient is bedridden. Then you have receding gum. It's very common, receding gum line. So this is very common. And then you have teething problems, teeth. This is another sign of osteoporosis. They start deteriorating and even falling because bones are weak. They're unable to hold the teeth. So this is another thing, which we should be aware of. Even doctors like us and orthopedic surgeons and physicians should be well aware of. That patient comes with this, maybe dealing with osteoporosis. Loss of height. हम देखते हैं कि वो छोटे हो रहे हैं. Their stooping posture, kyphosis, spinal deformities. So these are the kind of thing we have to look into. Heel pain. So these are the things which really indicate that person is suffering from osteoporosis, weakened bones. What is the treatment? Well, for the treatment, there are lots of drugs available in the market, but any trained physician, surgeon, orthopod will start with sodium, what we call alendronate, or which is commonly, Osteophos is a common drug, like we say crocin. It's, of course, is a branded drug, but it's commonly used drug. So Osteophos 35 is given for preventive and 70 given for therapeutic doses. And this is how we start the treatment with. And then we can go to, in women, we can start estrogen in postmenopausal women. Then there are zoledronic acids and bandronic acids and other denosumabs that come. We give teriparatide, all have different functions. Now, I will not go into detail because this is not purely an orthopedic event. So I'm not going to detail into it, how they work and what receptors they work on, whether they're osteogenetic or, they prevent the osteoclasts. So I will not go into details, but these are various drugs which are used by us. All these medicines have a very significant role. And of course, calcium and vitamin D, without saying, every common man knows about it, and multivitamin. But the message here is, please consult a trained orthopedic surgeons before you start anything. All these drugs are useful only when given under supervision. All these drugs can be very harmful and they can even be life-threatening. Some of them, especially injectables, if not taken under good care of a physician, of any doctor. So this message should go across to all the patients. So before treatment, how do we prevent it? Like I said, have good nutrition. Take daily doses of your calcium, whether in food. Like food can be nuts, or it can be seeds, it can be dairy products, it can be egg, and all these have good amount of calcium in them. Have enough sunlight in the morning. We are used to, especially the well-bred or well-heeled people, we are commonly stay indoors in air conditions. Our houses are air conditioned, offices, and even workplaces, our hospitals, clinics. So we all need to get out in the morning or even afternoon. The best time is 11 o'clock to 3 o'clock when the sunlight is good and really affects the specific rays they generate vitamin D in your skin. And so exercise is very common. Build up, especially for the young people. Now we are talking about elderly. One day everybody will become senior citizen, but what about the young people? We all know, and we should, that up to 25 or 30 years maximum is the time when you can build up your bones. And after that, they start leaching whatever you might do. So let's tell our school children, our young people, get out of their homes, play some sports, exercise to whatever time they have to build up their bones and to save their elderly life and lead a healthy senior citizen life. Please avoid cigarettes. Alcohol once a while is okay, but alcoholism is bad. Consult the doctors. Supplements, yes, do have them, as and when, again under supervision. To care, so let's care for those who once cared for us, our parents, our seniors, our all our elderly around. Let's take care of them together as doctor and physician, and all anybody who's listening who's not a doctor should start taking care of their seniors and their health first, and then people and their family and friends and neighborhood around them. So join us in celebrating IOA. Delhi Orthopaedic Association is also celebrating it. And join us. We are doing walkathons. We are doing marathons. We are doing cycling. We are going out of our clinics and out of our, it's an outreach program for the public in general. So I invite everyone to please take the maximum benefit out of it. And I greet all my orthopedic friends here and in joining us in celebrating Bone and Joint Week on the first week of August. Thank you. Thank you very much.
Thank you, sir, for a nice presentation. So now we should move to the next talk by Professor Sandeep Kumar. So I would like to invite Sandeep sir just to share his screen. Sir, please. He will be talking on fall prevention in elderly age group.
Good evening to all and happy Raksha Bandhan to all of you. On behalf of Delhi Orthopaedic Association, I welcome you to the seminar which has been organized by the young brigades of our DOA, that is Dr. Ravi and Dr. Karun. They need no more introduction. They are the pillars of DOA, and in a very short notice, they organized this webinar. I'm thankful to Dr. Samir for giving just a wonderful talk on osteoporosis. I also thank on behalf of DOA, Dr. Ashok and Dr. Chakraborty from IMA Karol Bagh for coming here and supporting us for such a noble cause. The theme of this IOA Bone and Joint Week is Old is Gold, 360 Care for the Elderly, ensuring mobility, dignity, and longevity. I think most of the population in our country, the life expectancy has increased, and the age of citizen of India is increasing. So the burden which we are going to have in future for the health is of elderly people. So we have to be careful. We have to know that prevention is better than cure. So ideally speaking, we all have to take care of their health so that the future of our country remains in safe hands. So IOA took this initiative. Our president, Dr. Anup and Dr. Ajit Shinde, they took this initiative that this year the theme should be based on the elderly, that is the health of the elderly and how to prevent it. So the talk is going to be on how to prevent the falls in elderly. So if we prevent the fall, definitely the fractures and other morbidities are going to decrease in elderly. The talk is a universal talk which has been prepared by the IOA and all of us, so that this is being presented all over the India for senior citizens. So fall prevention, what are the things which we have to be careful of? There are 5 or 6 things which are very, very important to prevent the falls. Do we know that at every 11 seconds, there is a fall of some elderly and who is presenting us to the emergency. So it is basically as Karun told, is a tsunami. It's a pandemic. It's a silent killer. We don't give so much of emphasis on this, but it is a silent killer. So the best solution is that we prevent it. So we need to have a balance and an exercise program for the elderly. Elderly have to talk to their family members and the friends to take the help. They should see the doctors and take the consultation. They all should always review the medications, because we all know that the medications in elderly people, you have to give so many medications which they have to remember, and sometimes these medications can cause dizziness or other things. So the fall is very pertinent. And also at the same time, take care of the vision and hearing, because maximum times what is happening, either the elderly is not oriented, or they are unable to see the things properly or hear the things, and that causes the fall. And at the last, make your home safer, because it has been seen in the studies that almost 60% of these falls are at home. So if you make your home safe, you will prevent these fractures. So it is common to feel unsteady at an elderly age. So what you can do, you can, if you are too unstable, you can use a stick. You can use the balance, strength, and flexibility programs. Do exercises regularly. Take a friend or a partner who will help you to guide and also support you at such hours. Talk to your family members, because many times what happens, these elderly people are alone at home. They think a lot. They don't have a lot of support with them. So always talk to them, even on phone or a video call. That is also going to help you. They will give you a moral support, and that moral support is very important. And then also the information you share with your family, so the family members can tell you more uh, things that you should take care. I'll just skip these because these are the same slides giving you that the family is very important. Talk to your doctor. So the doctor, whatever you have, just discuss with your doctor that whatever problem you have, either it's a hearing problem, either it is a vision problem, or if you are having a problem in balancing yourself, or you are unable to walk without the support, so that doctor can prescribe you the best thing, the support, either a stick or a walker or whatever, so that you prevent the fall. Talk to the other specialists. Those, they will help you, such as occupational therapists, physiotherapists, because at this age it's not only the osteoporosis, it's the sarcopenia also which sets in. So a trivial trauma, a trivial fall can lead you to the fracture, and lot of burden to the family, to yourself, and to the society. Also, review the medications. As I told you earlier, the medications are very important, because these medications, they cause dizziness, which can lead to, we have seen in our OPDs that sometimes somebody has given pregabalin or gabapentin or things like that, in which the patient can have a side effect of dizziness. So these, they cause dizziness, and the elderly can fall. So all these things are important. Make a list of your medication, that what medication is prescribed, how to take them, the eye drops, the injectables, and many other things, so that you don't miss. You can also make the reminders in your mobile phone or in your notebook, so that you keep on remembering these. Sleep is very important. Sleep well on time, and you have to be very careful at nights, because night, what happens when you are going for a urination, most of the time these injuries, they occur at that time. Either the light is less and there is some obstacle while going, and then you slip and fall. Then again, the pharmacy and the medications. Always remember that if you stick to one pharmacy, it is good, because the pharmacist also starts recalling you, remembering you, and he can also guide you. He can keep a record of the drugs, what drugs you have been given, and what you have not been given and should not take. And take care of your vision and hearing. As I told you, vision, most of us know that the cataract sets in. There are so many other vision problems, the glasses problems. So we have to be careful about our hearing, and vision things. So wear glasses properly. Now you have, ideally you should at least get a eye checkup at least once in a year. And beware of using bifocals, because these bifocals, they have two different curvatures of the glasses. One is for the short sighted, one is for the long sighted. And sometimes when you are going down these steps or climbing the stairs, it becomes a little hazy, and then you can fall. So remember that these types of glasses, you should take care that what type of a glasses, especially the bifocals, they should be avoided, or a progressive you can use it, right? Then the hearing changes also occur in elderly, so we need to be careful of the hearing aids also at the same time. Another important thing is the lightning. The lightning in the house should be adequate. Add a night light in the bedroom, bathroom, and a hallway. It helps you to navigate in the dark and find the light switches. Because if it will be too dark, then it will be a problem for you to move in the house. Make the house safer. We all know thousands of older adults fall at home each year, and due to common household hazards. So make sure your home is safe and help prevent falls. So how can you make it safe? Clear the way. Remove the tripping hazards like throw rugs, cords, or clutter on the floor. Move furniture to create a path for safe movement. Don't keep the furniture haphazardly. Secure some support in the buy a shower seat. If you are unable to stand, sit on the seat, and then there should be the and the grab bars in the bathroom, and then the seats should be of adjustable heights, so that it is easy for the elderly to stand up, to take care and prevent the fall. As I told you, lightening up is very, very important. Replace light bulbs with a bright, but at the same time, non-glare bulbs to help you to see around the house. These glaring, if the light is too sharp, then these can dazzle the elderly. Place a chair in your bedroom so you can sit while getting dressed or putting shoes on, because this is very important. Start using aids which can help you in wearing the shoes. You can see in this the shoe wearing stick, which is very, very helpful, because at this age, even a trivial uh, bending can cause the osteoporosis at the back. So we have to be careful of all these things, and keep frequently used items between waist and shoulder height. Don't keep the items at a very high height overhead cupboards, and it is easier to access without the need for a step stool or unsafe reaching. So try to keep the items at the waist and shoulder. So I think with this I will end the talk, and we know that to care for those who once cared for us is the highest honor. So we need to take care of our elderly. I think with this, I'll just stop the talk. Now, if we can have some discussion, if somebody wants to say something on this, then we can go ahead with this.
Thank you, Sandeep sir. It was nice and informative talk, actually, especially for the common people and especially for the elderlies. So, is there anyone who is having any question to Dr. Sandeep? Or else, I would like to invite Atul Vash sir, who is our past president of Delhi Orthopaedic Association, to have some words with us and regarding his experience, that any message for the elderly people, elderly population in our country. Atul sir.
Thanks, Ravi. And my presence today was to support my colleagues from DOA organizing this webinar on the theme of this year, Bone and Joint Week. And I want to congratulate both Sandeep as well as Samir for an excellent talk. See, this talk was a basic, and we wanted to educate the general population. So, from that point of view, all the prevention methods which Sandeep deliberately told us, I think they are the most important ones. And the people have to be taught or to be sensitized that your small aches and pains, they are important and to be investigated through a doctor. Because you must have seen that most of the time these elderly people, they come to you with backache, and then you see that there are healed old fractures of the spine. They are because these individuals have backache, they take some rest, take some medicines on their own, and they heal. But the basic treatment for osteoporosis never started. So it's for the elderly, at least, as Sandeep said, the aging population is now there. I have also started one course for geriatric medicine, just to because um, after a few years I will also be in the same stage to learn more more about this topic, and excellent job done. Congratulations.
Thank you, sir. Thanks a lot for the.
One thing I wanted to, Ravi, just
Yes, sir.
as an orthopedic surgeon, nowadays in females, like postmenopausal females are more vulnerable for osteoporosis.
Yeah, exactly.
And this now they have estrogen therapy they have stopped because of the increased incidence of malignancies in
Yeah,
ladies, and
yeah,
they have switched over to other good teriparatide and denosumabs and other things which we have now in our basket.
yeah, exactly.
So one thing which I wanted to put here that in females now osteoporosis treatment as estrogen therapy, replacement estrogen therapy is not very,
Yeah, it's not nowadays, according to the latest guidelines, it is not advocated.
yes, it is not advised.
Yeah, thank you, sir. Thank you, thank you. So, Manoj, what, sir? What, sir? Are you there?
Yeah, Ravi.
Yeah, sir. Please share few things with us regarding
Oh,
vast experience.
I'm sorry, I didn't hear the first part of the talk, but I heard Sandeep talk.
Yeah,
I would like to, give a message to my orthopedic colleagues. I think we all stress on osteopenia, osteoporosis. We also mention sarcopenia, but in the geriatric age group, in people above 60, I don't see many orthopedic surgeons indulging in strength training. We do talk about, sarcopenia, but we don't ourselves. We are not doing anything. So, lot of stress should be placed on strength training to women and men, doing with light weights, with TheraBand. So that should become an integral part. And then there should be they should be taught to attend classes for balancing exercises with yoga and Tai Chi. Or they can just, be told to look up those exercises on YouTube. Lot of neuromuscular coordination ka lack say that is one of the main reasons why people fall.
thank you, sir. Thank you.
Oh,
think very rightly said by Dr. Manoj sir. So it is a
Exactly.
basically a
These
uh,
are basic things actually we should keep in mind actually.
it is a collective effort of all of us, sir. We need to make the elderly people aware,
Yeah,
not only the elderly, as rightly said by Dr. Atul sir and Dr. Manoj sir, that we
exactly.
have to start this awareness from young age, so that the bone quality, the muscle strength, they remain good. Because if we start at the age of 70, we all know that the muscles already start deteriorating. Already the osteoporosis is set in. So we require drugs. The best time is the young age. If we train them, if we make them aware that how important it is. We all know that the life expectancy has increased a lot nowadays. 70 years is the new 50 or a 60 now. 70, 80 years. So we all have to take care of this, definitely. And exercises, I think, are very important. Tai Chi is also a very good exercise. I think we all should promote.
Yeah,
We all should not leave everything on our physiotherapists that go and just learn from a physiotherapist. I think as an orthopedic surgeon, we should also have a duty to tell them that how important this neuromuscular coordination is, and that you all should quickly, you can tell in 2 3 minutes that do yoga or do some flexible exercises or self weight training exercises. You don't need people, what they think, that the myth is that you should go to the gym, but this is a total myth. You don't require going to a gym to be fit. So for fitness, I think if you do your self weight exercises, that are good enough. Just you
Yes.
need to give some time to your body, some time to your mind, to your soul. So it is for all of us, I think, and also we should start. I'll request all the members, those who are attending this, said that in their OPDs and in their classes and teaching sessions, they should start promoting it, because I think this is the need of the hour. Thank you very much.
thank you, Sandeep, sir.
So well said by all our masters, orthopedic, surgeons, seniors, and everyone. I think one here, like Manoj Vatsal said about sarcopenia, and we did mention that it's a let's start early in life. School is the time when you have to inculcate the habit of sports. Now it's a challenging times for the parents and the teachers because of the social media. छोटे से बच्चों के हाथ में फोन होता है, इट्स अ कॉमन साइट. माँ खिला रही है, बच्चा खा नहीं रहा, फोन हाथ में है, मतलब हर जगह यही दिख रहा है. And he grows up, that's his life. Slowly we are turning into what America is, a lonely life, except, that's their only friend. So they're missing on their psychological part also. So everything is a chain reaction, everything is interconnected. So let's start young, get them out of their classes, out of their schools. And this is the way to go to treat osteoporosis in later life. Thank you very much, Dr. Ravi. Thank you, Karun, and
Thank you,
everyone.
sir.
Thank you very
Thank you,
much.
sir.
Ravi, can
God
I
bless.
make
Yes,
one
sir.
more
Sandeep,
comment?
sir, please. Sandeep, sir, please.
Matlab, at our times, we were having a physical education period in school, and it was
Yes.
compulsory to do that 15 minutes of a PT in an assembly, that everybody used to do that. I'm really surprised nowadays. No school is emphasizing on that.
Physical
No
activity.
school. Even my kids are going to school. I ask them, कुछ physical activity होती है, कुछ teacher कुछ कराता है, कुछ assembly में. They say nothing is done. I'm really surprised. I think with the support of all of you, I will take this issue with the authorities, that as you have made compulsory as per the NMC in a medical college also, that a physical activity session should be there. I think we should train them in school itself. If they get trained in the school that they have to do 15 or 20 minutes of exercise every day to keep themselves fit, they will continue throughout their life. Now what is happening, the foundation is totally wrong. उनको कोई सिखा ही नहीं रहा आजकल कि आपको एक्सरसाइज पीटी करनी है.
Now I would like to invite Dr. Shamik Chakraborty, who is currently the officiating superintendent of Sargangaram City Hospital and also heading the emergency department of our hospital. So Shamik sir, please share your experience about how to take care of this elderly age groups.
Very good evening to all of you, to everyone who have joined later on. It was really heartening to hear Dr. Sameer's view and Dr. Sandeep's view. DOA and IOA are doing very noble work, and this year's theme is very apt to take care of the elderly. First of all, we should definitely prioritize the diet which is rich in calcium and vitamin D3, and followed by, it should be like there should be the elderly should be taught about how to take care of themselves, especially the household. As someone mentioned, I think Dr. Sandeep mentioned, that they should declutter their houses so that there's a safe passage from the bed to the to the bathroom. They should take proper prescription glasses to take care of their eyes. They should take proper medications for the blood pressure. Sometimes in the elderly, we have seen with a lot of pregabalin and something like medicines for the prostate, there's a nocturnal dip, early morning dip in the blood pressure. There's a postural drop in the blood pressure. So we should adjust the timings of the medications so that they don't have a fall in the early morning. Sometimes they have a third-degree heart block, and sometimes the pulse rate comes down to around 50 or 60. There's a bradycardia. So we should be taking care of our medications very often. We should check with our physicians, and then use your flashlights. And proper lighting of the room is very important while you go to the bathroom or to the toilet. And definitely the strengthening of muscles. Muscles building is very important. And lifestyle, definitely one should quit smoking. There should be moderation in alcohol, and this goes a long way in preventing falls. So I congratulate DOA, Dr. Ravi, Dr. Sandeep, Dr. Atul, and Dr. Karun. They have done a wonderful job. Keep doing this wonderful job, and let's make our elderlies happy and healthy. Thank you.
Thank you, sir.
Thank you, sir. Thank you
Thank you,
for
sir.
the kind word, Dr. Chakraborty. And just to add a point, if everybody allows, I always say when we deal about osteoporosis, all the patients comes to us in our clinic with the complication, with the fracture or something like that. And osteoporosis is one disease where clinic has to go to home, or the healthcare provider has to go to home. We should make sure that we are giving them enough education at their home that we can prevent osteoporosis. So it is not home to hospital, it is hospital to home. If we have to treat osteoporosis in general population.
Yes.
We have to reach out. We have to reach out to them.
We have to reach out to them.
Thanks, Dr. Karun. We had a great meeting. So it's time to wrap up now. Thanks a lot, Atul sir. Thanks a
Thank
lot,
you.
Sandeep, Samir sir, my dear friend Karun, and all others who were with us just for this webinar in the evening, especially on the Raksha Bandhan day in their busy schedule. So thank you all
Thank
of
you,
you.
Ravi. Thank you very
Thanks a
much for
lot.
the
Thank you.
invite.
Thanks
Thank
a
you,
lot.
Dr. Ravi. Thank you. Thank you.
Thank you. Thank you. Congrats.